So hi, I'm Deb Center. I am currently the Education Program Director and lead coach at the Colorado Center for Nursing Excellence. And I have been a nurse a little over 35 years and have worked in interprofessional teams in a variety of settings throughout my career. For the past 5 years, I have led several grant-funded programs around training interprofessional teams in healthcare settings. And so I've had a lot of opportunities to work with a variety of disciplines. It's been really fun.
Explain to us what an interprofessional team is and what you mean by interprofessional practice.
I think that's a great question about interprofessional teams. And it's a question that people define differently in different settings. From my aspect, for the most part, it's around clinical teams where you have providers, physicians, PAs, nurse practitioners, along with any other level, whether it's RNs at the bedside, whether it's physical therapy, whether it's pharmacy, any other discipline, coming together to really focus on providing collaborative care for the patient versus separated care along the way. And it can be done in almost any healthcare setting.
That makes sense. Isn't that the way we've always done healthcare?
Well, they've all been there, but I'm not sure it's always been collaborative that as far as the way we've always done healthcare. All of us have been trained in completely different ways. We all have our own scope of practice. We have our own standards of care that we do in each of those disciplines. And so sometimes we go to work and we do our part, and we're not very coordinated together. And I think what we're trying to do with some of our healthcare delivery model changes is to really get us all on the same page so that the patient really gets the best care and gets the right person at the right time doing their care.
Can you give me a couple of examples of how interprofessional practice either does or doesn't work?
So it doesn't work, probably I have a lot of examples where probably one of the most frustrating things I've seen for nurses is when they walk into a patient's room or have a patient come in and they don't know what the provider has already said to them. And so maybe the patient's ready to be discharged from the hospital and the nurse didn't know they were discharged. And then the nurse looks like she or he doesn't know what's going on with that patient's care. So it can really kind of set us up to work against each other instead of together.
Can you give me an example of a really positive?
Yeah, one of my favorite places that I worked for several years was in a long-term acute care setting where we had very sick patients that were not sick enough to stay in an intensive care unit for a long period of time, but they were too sick to be in any other setting. The majority of them were ventilator patients that were very critically ill. But we had a team in that organization where we had a hospitalist that was on that unit, and every discipline was housed in the same clinical setting. So their spaces were all geographically located. We had respiratory therapy, physical therapy, occupational therapy, social work, nursing, and CNAs. Some of these patients would have never ever gotten off the ventilator and some of the equipment that they were on had they not had all of these disciplines working together. And I can still remember one patient that it was really his last chance to get off that equipment coming to that setting. It was either that or hospice really was it for him. And because we could coordinate all the right people at the right time, we would have a respiratory therapist with a physical therapist and the nurse all walking the patient on the ventilator at the same time to move muscles in a way that couldn't be done in an intensive care unit. But because we could coordinate everybody and have everybody on the same page, that patient got off the ventilator and was discharged with a big celebration at the end of that. And so when we do it, we can really take the expertise of each discipline to really pull it together and do some really great things for the people that we serve.
So what are some of the barriers to interprofessional practice? You mentioned the way that healthcare professionals are educated. When they get out into practice, what makes it hard for them to have that coordination in care?
I think with the teams that we work with now, the fact that they were educated separately and they really didn't spend time learning together, they really don't understand what expertise each of the other disciplines have. And so when you have opportunities for them to learn that about each other and create teams where they get to share their expertise, I think that can be a really great opportunity. It's time, it's effort, and anytime you have to do those, it takes it away from other things you have to do. So you have to have time to build relationships so that you trust each other and you understand what each of you do.
As a healthcare administrator or healthcare manager, what do you need to know in order to make sure that your facility maximizes the potential of interprofessional practice?
I think it's similar skill sets that all the disciplines have to know. They need to know that we all have to ask some questions. We have to have time to communicate. We have to have spaces where, if they're leading it, that they coordinate times for these groups of individuals to huddle and have time to work together and to work on the really good things as well as the challenging things. I think the biggest barrier to all of this is communication, and I think their role can probably be the key to setting the tone for communication, creating team agreements where we work together and we are all really having a shared vision for the same purpose. I think it's an essential part of the team, and if they're left out because they're somewhere else, I think it can really kind of interrupt the whole flow of the team.